How's it going, everybody? It's Josh Rimini here with your Functional RX podcast number 2 for 2020. We're actually going to talk, this episode is going to talk about what is cardiometabolic mean and how does it matter to me, you know?
Big word. Probably
fancy
a big
college word.
Yeah, so break that down into unfancy word for us.
So the reason we say what is cardiometabolic is because in the first part of this year, you know, our theme for 2020 is to build this awesome wellness community. And the first part of that is to understand, you know, what is cardiometabolic risk. And it really is a combination of two things because we have to address them at the same time. And that's really the big component of what we're talking about here. So cardiometabolic is literally cardiovascular.
So heart health.
So cardiovascular system. So heart is a big piece of that, but vascular system and all that type of stuff. So cardiovascular disease, excuse me. And then metabolic, so cardiometabolic. So metabolic disease is what people would think of as overweight, type 2 diabetes, metabolic syndrome, which is sort of pre-diabetes, the chronicity of that. And they're interrelated. So we have to look at them from the standpoint of them being the same and not separate body parts, right? I've talked about that in the past, is we got to treat the body as a whole. But you can't understand cardiovascular without understanding metabolic, and you can't understand metabolic without understanding cardiovascular.
What are some examples of cardiovascular diseases?
So blood pressure, high cholesterol, stroke, congestive heart failure. You can even look at any type of heart dysfunction. You know, anything that could be considered. You know, you've got what is the word I'm thinking about? Like heart flutters, things like that.
Yeah.
Anything that has to do with the cardiovascular system. So we know it's CVD, cardiovascular disease, right? So it's atherosclerosis, which is hardening of the arteries. It's too much cholesterol. It's cardiovascular risk, right? So the problem with that is people think heart. They think vascular. That's it. Well, the problem with vascular is because of the metabolic disease we have. So when we talk insulin dysfunction or blood sugar, because people think blood sugar is the problem, it's actually the insulin dysregulation that we're talking about. It's the insulin sensitivity and all those types of things. So you got to talk to them in the same space because cardiometabolic disease refers to cardiovascular disease, type 2 diabetes, and stroke. So if we decompartmentalize those two into different places rather than looking at them at the same, we know diabetes constitutes cardiovascular risk, right? But we don't necessarily so what does that mean? It means if our insulin isn't regulated properly, we're not going to actually have our metabolic reserve, physiological resistance, all these types of things, inflammation. So inflammation and insulin resistance are really the two drivers of, cardio and metabolic. So it's not the cholesterol that we're worried about so much anymore. It's the inflammation that's caused by the cholesterol, that's caused by the this, that's caused by the that causes the thing, right? So that's where we're talking about with this. So you have to address cardiovascular and metabolic at the same time.
So when people are coming in and they see that they have an issue or their doctor tells them that they have an issue, what are some of these common issues that they're like, you have this, so you need to go see a pharmacist?
Well, and that's kind of the thing is most people know, it's like, all right, I'm pre-diabetic because my blood sugar was 99 or was above 99. So I went to the doctor, it was 105, and then I went back and it was 105. So that classified me as pre-diabetes. They put me on metformin. They mentioned that exercise and diet was kind of important and that I should try to change, right? That's usually the transition of what happens. And what happens is, and metformin is a great drug. We use it a lot. You know, it's really good for weight loss too. What happens is that patient takes the meds. They don't really adopt lifestyle change. They don't address their stress levels, their gut, their food plan, there's supplements. There's so many different personalized supplementation and nutraceuticals that you can use for cardiovascular disease that are beyond the script. And the same for metabolic disease. We can treat insulin regulation and dysfunction. Does that mean I'm going to treat a type 1 or type 2 diabetes with only supplements? No. But what are they doing to modify the system? So you could take your blood pressure medication. You can take your cholesterol medication. You take your blood sugar medication.
Seems like a lot of medications.
It is, but what does it actually do? It masks the symptom of those problems. And it doesn't actually help.
I like what you said.
It
doesn't. If you don't adopt the lifestyle changes, it's just going to mask the symptoms, and you're never going to get better. You're just going to have to continue masking the symptoms for the rest of your life. And
generally speaking, that's the prescription evolution we see in people, right? You take 1 or 2 medications. You don't adopt the lifestyle.
You had to get there somehow, and if you don't change that, you're going to stay there.
And that's where the continuum of health versus disease. Right? Disease, dishealth happens. So if someone takes a medication and they think that's going to work, tell me, give me an example where medication alone fixed the chronic problem.
Yeah, it won't fix it, it'll mask it.
So it masks the symptom of the disease. Nothing gets better, it actually gets worse. The insulin resistance gets worse, the blood sugar gets worse, the cholesterol gets worse. How many people stay on one blood pressure medication without lifestyle, right? They add another medication, and all of a sudden they get stuck in that whirlwind of their health that's what's normal to them. I'm not better, I take another medication. My numbers don't get better, I'm not better, I'll put on another medication, when the root cause of this is all stemmed around insulin and inflammation.
So insulin. When we start thinking about that, that is high carb, high sugar type food.
Well, it's talking about insulin resistance, right? So when what causes insulin resistance and what causes insulin recovery is really what we look at. So inactivity, environmental factors, stress, nutrient deficiency, obesity, lack of sleep, all of these things affect what causes normal process versus where glucose is absorbed into the tissues and processed through the pancreas, and the pancreas secretes insulin. Well, if we prioritize insulin resistance and have those choices, those lifestyle choices have a profound effect on our blood sugar levels. This chronic condition, which the cells resist insulin, thereby leads to the elevations in blood sugar and chronic inflammation. So then you have that feed backward cycle that creates the problem. So yes, sleep, skipping breakfast, having high carb food, all those things contribute to the blood sugar being elevated. Therefore, the insulin has to work harder. Therefore, the system becomes more resistant because it has to keep producing more. So it becomes normal, right? It's just like same thing with stress. The more you pile on the stress, the more cortisol happens, and the more the cells get used to that, so therefore they're not reactive as much, right? Mm-hmm. That's what happens. So we have chronic inflammation risk, we have insulin resistance. If we can fix both of those things, it just doesn't work with just medications. And our awesome next podcast is going to be talking about what's the difference between cardiometabolic fix in prescription land only, and what we do in a functional and lifestyle prescription for a patient. So in this case, we just have to define it to people, because they got to understand we've got so many things we need to do to improve inflammation, insulin recovery, looking at the stress levels and what that looks like, the cholesterol, not just as a number, but a particle size, and what does that mean, all of those things. Stress, diet, environmental factors, physical exercise and activity and movement, all of those things play a role in this functional prescription that we use in this cardiometabolic space. Just think of it this way. We're seeing a rise in type 2 diabetes in children, whereas we used to classify type 2 diabetes as what? Adult onset diabetes. It's no longer caused by that, because we're eating sugary foods and all of those lifestyle factors. We're more stressed out, but really it's diet and it's exercise. It's all these things that we're doing at a very early age that's contributing to type 2 diabetes in 8-year-olds. Not type 1, not like, onset.
I mean, what
juvenile.
Is it video games and computers, and so they're not getting out and playing?
Predominance is diet, right? 80% of this is food. So yes, we're video games, so we're sedentary and we're eating worse foods all day long.
It's not a good combination.
It is not. It's a combination for disaster. And
I just saw a study out there.
Everybody sees it. The over 60. What is it? I can't remember the percentage, but in the next 5 to 10 years,
this is what I saw. Yeah, in the next 5, I think it's over 60% will be type 2.
Morbidly obese.
Yeah.
We're not talking overweight anymore. We're talking morbidly obese.
Yeah, I saw the same stat.
And it's going to bankrupt our country, and it's this one condition alone. If we treat it the normal healthcare system way. Mm-hmm. This is what we're talking about here. We're talking about treating these cardiometabolic diseases from a different perspective so we can actually reverse and change this pathway. So this is why we're trying to create this wellness community.
And this is where you, as a functional pharmacist, really like to play, because you can have somebody start on metformin, and they need to start on that. But if they're not adopting these lifestyle changes, you can also show them the lifestyle changes that they need to make so they can slowly transition off of the metformin and back onto whatever that health nutrition thing that they need to do to make the change.
And it's hard, right? This is why people like the pill for the ill. Give me the pill. I'm cool. It's easy. Well, lifestyle change is hard, which is why we put health coaching in there. Everybody needs to eat the right food plan, but do they need to eat it all the time? No. I love the 80-20 rule. So 80% of the time we can get transformational change. So that means we have some, food, endorphin, dopaminergic triggers that make us happy, chocolate, whatever it is, right? But a little bit of dark chocolate is really good for your cardiovascular system. But in abundance, we know it's a problem, right? So red wine is great. Bottles of red wine is not so great. So we need to make sure that we're working on trying to fix this whole system and doing it as a community and giving ourselves accountability partners along the way, because that's how we're going to create the community, and that's how we're going to actually implement change.
Right.
Because it's all about implementing change. So food's the big one. Food is medicine. Food is information. I've said that 1,000 times. So we're going to make sure that people are on the right functional foods and the right first step interventions, and that they're feeling better. Who doesn't want to have more energy, feel less pain, lose weight, and feel good about themselves? We can all do this. It's just a step-by-step plan, and that's what we're trying to make sure people have. And hopefully we'll be able to do this because we'll be doing some seminars too, so people can just come to a seminar and say, all right, what's the plan? What's the first next step? That kind of thing.
Awesome. Well,
so
guys,
that's kind of cardiometabolic.
Yeah, don't forget to, if you like this podcast, don't forget to go on there, leave us a rating, leave us a review. If you've got a review you want to write about us, I'll get on here and read it, because Josh won't know where to find it. But we'll shout you guys out.
And that's also something that I really want to say is, like, we've been talking about, like, how do we get relevant content that we really want people to understand? We've got a plan in place. But if you leave a review or you want to leave a comment that says, I really want somebody to talk to me about this, we're happy to put those in these podcasts. This is for the community. This is my way of getting this out
to
more than one-on-one conversations that I've had for years and years.
Right.
This is a great medium for us to do that. So thanks, guys, for listening. I appreciate it. We'll see you next time. I am Josh Rimini, and this is your Functional RX podcast.